This conference will now be recorded.
So, Bismillah ar-Rahman ar-Rahim. And should I start?
Yes, Professor.
Okay. Dear respected participants, welcome to this webinar. And myself, Dr. Muhammad Umar Zafar Khan. Currently, I'm working as Assistant Professor of Microbiology in the Institute of Microbiology, University of Agriculture, Faisalabad. And today is our second lecture of the series is regarding One Health and the Food Safety Plan. And here we will discuss about the One Health. First of all, what is the One Health? The One Health is the collaborative interdisciplinary approach that recognize the interconnectedness of the human health, animal health, and the environment. Because if any one of these from this triangle is missing, the definition of One Health is not complete. So there is the need of collaboration among the human health, veterinary health, and environmental health sector. To achieve this goal simultaneously, we have to work together in all these sectors. And what is the importance of One Health? As we live in this world that is rapidly changing, the complex and the progressively, things are the more interconnected. Then the convergence of the people, animals, and our environment has created their new dynamics, and in which the health of each group is now profoundly and inexorably linked and elaborately connected. Because the One Health is also important, apart from this scientific definitions, if you talk in the layman language or the simple language, the One Health is also important because in many countries now the food is used as the processed food. So if you don't have safe food, and if you don't have the standards to meet save the particular food like the milk, the meat, and other perishable commodities, so it may deteriorate the health of the consumer. It may be human, and it may be because in animals also we are using the feed like the silage and the hay, we preserve that all stuff. So if the health is not properly taking part for the appropriateness of this mechanism, it may harm to the health. Either it's human health, either is environmental health, and either it may be animal health. So we cannot neglect any one of them. So the food safety ensure that the food is free from contamination and possess no health risk to consumer, achieved through the proper handling, storage, cooking, and hygiene practices, as well as adherence to the sanitation and the regularity guidelines. So for this, we have to follow strict hazard measures and other rules for the food safety and food security, because food safety as well as the food security, these both are very important when they come into the human interaction. Because if the animal feed or the animal commodities we cannot properly process and we cannot properly handle the things, it may lead toward the development of disease, and it may serve as the zoonotic carrier for the development of the diseases. So how One Health and food safety are connected? So the scope of One Health is impressive, broad, and growing, and the much of the recent focus on the online on One Health has been limited to the emerging infectious diseases. Because now, if we recall our 20, 30 years before, so there were no such diseases that prevailing right now, because the environment and the things change very quickly. And emerging infectious diseases, the concept clearly embraces the environmental and ecosystem health, social sciences, ecology, non-infectious diseases, and chronic disease wildlife, land use, and antimicrobial resistance, biodiversity, and much more. So these are other important factors that may help to achieve our One Health goal if we have to properly treat with or properly take care of these factors. So safety, health, environments are very important. And over the past 3 decades, approximately 70% of the new human infectious disease have been zoonotic. And the global population has now exceeded 7 billion people, and the estimated 30 billion food animals were produced from the help feed this population and meet its growing demand for the protein from animal sources. The result is the phenomenal global food system that is both a major agriculture and the business accomplishment, and an unparalleled change that is creating the major societal issues that some extent threaten human, animal, environmental health. So this is a report by the FAO. So we can imagine that the 75% the new human infectious disease are zoonotic one. So if we don't take care about the diseases that are coming from the environment, that are coming from the animal source, so it directly help harm to the human immune system or the human population. So this is very alarming. So we have to think about this seriously. And the global human population is expected to reach 9.7 billion people by the year of 2050. And as the human population continues to grow, we face increasing challenges to ensure the people will have access to the safe, nutritious, and healthy food. And by the 2050, the food production will need to increase more than 50% of 2012 the production level to meet the demand. And as income in developing countries continue to rise and the living condition improve, the demand for the meat, dairy, and the specialty crops such as the fruit, nuts, and the vegetable has increased. But the situation is opposite in the underdeveloped and the developing countries as well, because as the growth of the population is exponential, so but the resources or the food is not growing, or the crops are not so much, the yield is not so appropriate to increase according to when we compare the population growth. So the threat related to the food safety is: number one is overpopulation, number second is zoonosis, and number third is food security issue. So overpopulation is very important concern toward the food safety and food scarcity, and mainly for the food scarcity. So the second one is the zoonosis. So if we talk about the zoonosis, so it is very important and the main duty to control the zoonotic diseases towards the veterinarians, because if the person is working in the meat industry, they have the veterinary officer who is responsible to make sure the quality of the healthy meat that is coming from slaughterhouse to the market. If we are talking about the poultry meat, or if we talk about the eggs, if we talk about the milk, so in every domain, the veterinarian is the crucial person who is responsible to maintain the healthy and safe food for the human consumption. Because in villages, it's common practice. So the people would like to drink the raw milk, and they think that that milk is very nutritious and very healthy for their health. But in the reality, that milk is the source for the tuberculosis. The raw milk that is the from the directly the streaks to in their mouths from the cow or the buffalo, and they think that milk is very nutritious, but in reality that milk is the source of tuberculosis. So we have to avoid this. Always use the milk after boiling, or maybe use the pasteurized milk. Don't use these sort of the things. And if you talk about the food safety, and food safety again, many things that are prevailing, the quality of the milk and the microbial load and the what quality of the meat, milk and eggs are coming into the market is very important. So again, I will emphasize the role of the veterinarian is very important to maintain the integrity of the public health issue. So, threat of disaster. The globally, 820 million people suffer from the food insecurity and experience chronic hunger and undernourishment. And most of these people live in the extreme poverty, earning and they are earning less than $2. So here you can think that the person who is earning is less than $2 per day, how he or she can sustain this society. And the sustainable agriculture production must be basis or to achieve the food security, reduce malnutrition, and elevate poverty. And the reduction of undernourishment has been significant strides over the last 10 years. And here I would also like to share one more thing. As we people know that the precision medicine and the precision treatment or the precision veterinary medicine also, so also nowadays there is the practice in the agriculture, the precision agriculture is there. Like we treat exactly as the disease because with the help of precision medicine on the same pattern nowadays the modern farmers or the modern scientists from the advanced countries, even though some developing countries, the scientists adopting the strategy precision agriculture, and that is also very important and helpful to achieve the maximum yield from the crops and control the disease and maybe cause the resistance toward the different diseases, and very important to the precision agriculture. And here is the, you can have the broad way about the example of the microbes entering in the food chain via the plants. So like if you talk about the vegetables, the most important source is Bacillus cereus is also common. That comes from the vegetable. And E. coli, Salmonella, enterica, norovirus, cyclospora, and hepatitis A. And these are the common microbes that are coming from the plants or the vegetables. If we are not treating them properly and cleanliness is not achieved properly and the water we are using for their irrigation is not clean, maybe coming from any other hospital waste or from any improper treatment is given to that particular thing. So the things become very worsened because I have seen many cases the people they are suffering from the liver disease and maybe chronic intestinal issues just due to the use of the consumption of the vegetable or the meat that is the quality is compromised. So again, we have to take very much concern about the water we are using for the crop cultivation. It must be clean water, and maybe if not clean, at least it should be filtered if possible before we irrigate that crops. So, if we talk about the microbial threat to the food security from the animal origin, so there is this is the brief list. The list is too big. Just I use very important like the Salmonella, Escherichia coli, Listeria monocytogenes, Campylobacter, Toxoplasma gondii, Brucella species, Cryptosporidiosis, Toxoplasmosis, Trachinellosis, Teniasis, Anisakis, and these are the very important diseases that are originated from the animal source. So if we have to take care about the meat origin or the dairy or the meat, poultry, eggs, so we have to very much vigilant before the dispatch of that eating stuff or the to the market. We have to take care about this very carefully. Plant disease causing the reduced production, the bacterial wilt, the tomatoes, these are the diseases and the affected crops I have mentioned. The bacterial wilt, the tomato, the cucumber and the potatoes and the fire blights, the apple and the pear trees and powdery mildews, the roses, cucumber, squash and the rust wheat, the barley, soybean, roses and hollyhocks, mosaic virus, tomato, peppers, cucumber and beans and the tomato spotted wilt virus, tomatoes, pepper lettuce, and the root knot nematodes, the tomatoes and the potatoes and the carrots, and the downy mildew, the grapes, cucumber, and the lettuce. So these are the common diseases. The vegetables or the crops that I mentioned here. That is not mean that they are limited to their. Also, they affect many other crops that are not mentioned here. So here you can imagine that the disease or the bacteria or the virus or the fungus or the nematodes or the parasites, they are very, very important to control. If you are not controlled in a effective way, it may harm the growth of the vegetables and it may decrease the yield or ultimately if apparently the vegetable or the fruit is seems to be the okay, but we when we cut it for the consumption, it may not standardized or it is not able to use. So these are the things we have to take care about, and the proper the spraying or the cleanliness is very very important for this. That's why now the scientists they are giving emphasis towards precision agriculture. So in the precision agriculture, the goal is make the crop more resistant toward the disease so that we can get the healthy yield after the production when the cycle is complete. So and the less attack by the bacteria or the virus or the other insects to the consumer. So here is the animal disease causing the loss in the production like the foot and mouth disease. The foot and mouth disease is one of the most notorious disease globally for the it, either it is the beef industry, either it is the milk industry, either it is the hide industry. So here the foot and mouth is there. That is the serious headache of the dairy industry, along with sheep and goat, and also affect the pigs. Avian influenza that hits the poultry industry, chicken, turkey, ducks, and geese, and classical swine fever that is for the pigs, and the Newcastle disease poultry, chicken, and African swine fever. Also, the main affectee is the pig, and the BSC, bovine spongiform encephalopathy, and the that mad cow disease, and the porcine reproductive and the respiratory PRRS that is also affected by the pigs, and the infectious bursal disease, the Gumboro disease, and that is mainly hit to the poultry. So we have to make things very clear. The appropriate vaccination schedule is very, very important to control these diseases. So the thing is that if we control the diseases via the vaccination, if the cost we are using to control the disease, ultimately I think that amount or that price will be the less as compared to if we have to treat or we have to cure the animal after the outbreak. Prophylactic measures are always important and easy to control the disease, but the outcome or the outbreak is always difficult to control. So main driver of the increasing global hunger is the climate change. The recent example now, the people are debating that is not my area, but the people are debating like in the heavy rain in the Dubai, they are considering that is the influence of the they play with the weather or something increase the global weather and something like that. There are many people are debating about this. So that is not my topic. I'm just giving the climate change is also because if the climate change, the global warming, that impact on the weather, and the weather directly impact on the production of the crops, and if the crop hurts, definitely the production for the fodder is also affected, and the food for the animals also. So that is the direct driver, main driver to convert the increasing the global hunger. So climate change is very important. So that is why we also concern about the global health, and we also take care about the environment for the taking care of all the appropriate things, so we don't have to play with the environment and the things that are controlling. And also if we disturb the ecosystem, so we have to pay the price. So that's why we have to take care these things very seriously. So what are the strategies to overcome food security issues in the One Health perspective? So these are the main points. The important, the nutshell is to promote sustainable and precision agriculture, enhance animal health management. The use of vaccination is very important, and address zoonotic diseases, improve food safety for small scale farmers, and also give them the training and educate them and how they can prevent the disease and biosecurity and all these things. They have to be very much trained about these things, and promote nutritional security and mitigate the environmental degradation and the strengthen collaborative partnership, because many things I came to know in my experience. So if we work in the collaboration, so to found the solution is becomes very easy, because the different minds come together. So in this way we can got many appropriate and the different solutions. So I always encourage the collaboratory work and the collaboration. The work in the collaboration is always very fruitful, and it also help to decrease the time to get the maximum things in a short time. And the in the role of the One Health practitioner, and number one is the strategies is the engaging public. So we have to engage the public. We have to give small training session or the lecture or the webinar or something like this. We have to give. So what is the role of the public? Public should also participate in this, because if the public know the basic about the One Health and the food security and the food safety, so this will also work as a positive way. And also the second thing is the scientific research and the development in the strategy two is, and where the researchers and the scientists, they can help to develop many other good points and good strategies, and maybe always also they can give the strategies to control the diseases. That is also very important. And the policy makers or the policy making, that is the nutshell of the for the working paper. Like the policy making is very important, because the policy makers, they give you how to work and how we can control the things, and they give the guidelines and they give the strategies how we can work smoothly. So the policy makers are very important to work with the different environment. Like we can work in environmental issues. So the person who is an expert in the environmental issues, he or she can develop the strategies regarding the environment. If the issue is regarding the animal health, the person who is expertise in the animal health. So the same with the agriculture, all the person who are the top researchers and the top scientists in their domains, they can give the working paper to control the diseases effectively. So that's why the policy making is very, very important. So this was our today's lecture. I try to make it easy and comprehensive for because we have the wide vast audience from the different backgrounds. So if you have any questions, so I will be more than happy to answer your questions. Thank you very much.